Welcome to Coping Together, Mental Health Association of Central Florida's live web series dedicated to helping you develop coping strategies and wellness tools related to COVID-19, as well as talk about mental health. Coping Together was created in response to COVID-19's mandatory social distancing orders. This show seeks to learn and educate. We do not speak for any particular group. Overall, Coping Together serves as a platform through which we can demystify and unpack mental health concepts and hear from experts in the field. Please note that this show may discuss sensitive topics including but not limited to sexual assault, suicide, and various traumas. If you find yourself feeling upset or struggling during any episode, listen to your body and pause the input. We will post related resources. Remember, it's okay to get help.
Hi, everyone. Welcome back to this week's episode of Coping Together. I'm your host, Faith, with the Mental Health Association of Central Florida, here to talk to you about all things related to mental health, COVID-19, and how we're all going to get through this journey together. So today, I'm very excited to talk with Anne Packham, who is the Marketplace Project Director with Primary Care Access Network. And today on Coping Together, we're going to talk about something that we really haven't covered, but is so important to cover, especially right now in this time of year and with everything that's going on. And that is really talking about affordable health insurance for Floridians. And so with that, I will introduce Anne. Anne, how are you today?
I'm great. How are you doing?
I'm good. Thank you so much. And I really appreciate you coming in. And Anne actually has some visuals prepared. And I think that when it all comes to insurance, some of us, at least for me, internally cringe a little bit because we're a little scared. We don't know what's the best plan for us. We don't maybe understand it. And that's kind of why Anne is here, is to help make sense of it. And so I think these visuals are really going to be a helpful tool. So with that, Anne, I'll go ahead and let you get started. I might jump in with a couple questions every now and then, but just thank you so much again for being here.
Well, thank you very much for inviting me. And as you said, it is really important to talk about health insurance. This is the open enrollment period for the marketplace, which is November 1st to December 15th. Now, it's important to remember that about half of the people in the US, right, have their health insurance through their employer. So they don't usually have to make a lot of decisions because the employer will offer them a couple of plans and they'll sign up, and that's the way it goes. Another, 40+% of people in this country have either Medicaid, Medicare, veterans coverage. So we're really talking about, 8 to 10% of the population that's not covered through any other source that could really benefit from looking at the health insurance marketplace. So that's kind of what I'm going to focus on today in my presentation. I'd just like to give a little bit of a background. I'm going to just give a little bit of background about the Affordable Care Act. So you know where I'm coming from and what a navigator is. That's what I am. How the marketplace works, how to enroll, and how to schedule an appointment, because those are the kind of like key really things that you need to know. So a little bit about PreCan, just so you know where I'm coming from. We're a nonprofit organization in Central Florida. We've been around for over 20 years, helping people, especially people who don't have health insurance, get in a source of primary care, right? So the whole idea is that people will use their primary care doctor and not use the emergency room for regular care. And then in 2013, we became a recipient of a federal grant, which means your taxpayer dollar pays our salary to help people understand how the Affordable Care Act works. We call ourselves Navigators, and we are licensed by the state, certified by the federal government, and we provide unbiased support. Unbiased means we are not going to try to persuade you into purchasing a plan that doesn't meet your needs. We're not going to sway you in one way or the other. We don't work on commission. We're not going to try to sell you life insurance. We're just trying to help you figure out how this whole process works. So that's kind of where we're coming from. And I'll list a little bit of a history about the Affordable Care Act, because I think a lot of people, there's a lot of myths around it. There's a lot in the media about it. So it is a federal act that was passed in 2010. So we're in 10 years into it now. And the most important thing that people talk about, it's a big piece of legislation that affects how hospitals do work. There's a lot of things in it, but the most focus goes on what's called the health insurance marketplace. And that's where people who don't have health insurance through their employer or any other government source can buy private health plans with help from the government to pay for those plans. People confuse the terms marketplace, Obamacare, exchange with the Affordable Care Act. All those get wrapped into one, but we're basically talking about the same thing, which is an opportunity for people to purchase health insurance with help from the government. And then these are all of the, the things that the protections that health insurance has now because of the Affordable Care Act, right? So having a pre-existing condition does not exclude you from getting coverage as it did before. You cannot have your health insurance plan stop funding your care in the middle of your illness, for example. So before the Affordable Care Act, if you were in the ICU, let's say for a really extended period of time, your insurance company could say, you met the $1 million limit, you're done. That can't happen anymore. And most importantly, the plans have to be comprehensive. So they have to cover not only your preventive care, but your doctor's visits, hospitalization, mental health, which includes psychiatric, counseling, and your drug costs. So they have to be comprehensive to be allowed under the Affordable Care Act. So that's the basics 101. Why do people not sign up for health insurance? Well, there's three main reasons that we found over the years, right? First is cost. And whether it costs $0 or $50 or $100, people perceive it to be unaffordable. So they assume right away when they hear health insurance, I can't afford it, it's too expensive, I'm not even going to go look at my options. A lot of people can get plans that cost them absolutely nothing. Second is just not knowing, how do you get to the marketplace? What is this Obamacare? I've heard about it, but I don't understand it. So our job is to, provide that information to people. And then finally, people say, well, I'm really healthy. If I get really sick, I'll go to the emergency room. So I don't need to go for all, I don't need to pay money for all these preventive things. And I'll just deal with the emergency room bill when I get it, which ultimately leads to the number one cause of bankruptcy in this country, which is medical debt. And it also means that once you go to the emergency room and find out maybe you have a cancer diagnosis or maybe you need a treatment, now you can't get that treatment because you have no way to pay for it. So these are the three barriers that we're trying to overcome and letting people know. This is why we do this sort of educational work. All right, so let's get into the meat. This is the other interesting slide that I like to present is that people who don't have health insurance, the research shows, tend to get their care much later. They get their diagnosis of a disease, for example, cancer, instead of catching it at stage 1, they're catching it at stage 4 when there's very less likelihood of being treated successfully. And they wind up paying a lot more money, right? They use the emergency room, they go into debt, and it leads to this vicious cycle often of losing your job, losing your health insurance, being in poor health, being absent from a job. So having that insurance of knowing that you can go to the doctor if you're feeling not well, it really helps people in their general sort of overall life, their financial health, their mental health status. Okay, so who can get on the marketplace? Really, there's only 3 main criteria to get on the marketplace, right? So first, you have to live in a place that has a marketplace. We're in Florida, so that's not an issue if you live here. You have to have a lawfully present immigration status. So what's that mean? You're either a US citizen, a green card holder, you could be an asylum seeker, you can even be here on a student visa. Essentially, most immigration statuses will qualify except for those who are completely undocumented, have no papers at all, or maybe just here on a tourist visa. And then, of course, you can't be incarcerated. So if you're in jail or prison, you're not eligible to jump onto the marketplace. In Florida, we have 1.9 million people enrolled in insurance, and we are, of all the states that use the federal healthcare.gov system, we have the most people. We have a lot of people in Florida who work part-time jobs. We have a lot of people who work for small businesses. We have people that move here from other states, maybe to take care of an elderly parent, for example, and they're working part-time, but they're not taking a corporate job or a full-time job because they don't want to. They're older, they're older in life and they want to enjoy our lovely sunshine, work part-time. And so they would jump on the marketplace. So there's a lot of reasons why we have so many people in Florida who are enrolled in the marketplace. Okay, so here's the big question that everybody asks. I qualify for the marketplace because I live in Florida, I'm not incarcerated, and I'm a US citizen, but how do I get the financial help, right, to pay for this? Because I can't afford health insurance on my own. And as you'll see from this little statistic down here, more than 90% of everybody in Florida who's on the marketplace does qualify for financial help. So what do you have to do to get that help? You have to have something, well, the financial help is called the advanced premium tax credit. What does that mean? That means the government is helping you pay your health insurance premiums in advance of what you would be earning on your income tax the future year. It's kind of complicated because you have to project your income into the future. So for example, right now, people are projecting their 2021 income, and sometimes it's hard. Maybe you're in a small business and you don't know how the business is going to do. Maybe you're self-employed. Maybe you've lost your job and you're hoping to get hired back, but you don't know if that'll be in March or in June. So you have to kind of make a guess based on your circumstances. But you have to have an income that's at least 100% of the federal poverty level. So for the year that we're going into now, this is what 100% of the federal poverty level looks like. Your household size, by the way, is not necessarily who's living underneath your roof, but this is who's in your tax household. So if I'm single with no dependent children, I'm a tax household of one. I do my taxes on my own, and I have to have an income of $12,760 for the next year projected in order to qualify for the financial help. If I'm going to earn more than $51,040, I won't get any help. It doesn't mean I can't purchase a plan on the marketplace. It just means I won't get any help doing it, right? So you still have all the protections of no pre-existing conditions, no health questions. It's just that you don't get help. If I'm a tax household, yeah.
Oh, sorry, just real quick. It seems like so COVID, do you predict that there's going to be a lot of people kind of wondering or having trouble predicting their income for next year with everything that's happened with COVID?
Yes, I'm finding that every single day. We help people kind of talk through that. So I was talking to somebody yesterday who lost his job, in the entertainment industry. So right now he's not working. He hopes to be hired back by the summer. But I said, so, what are you living on? Well, I have a rental property. And I said, well, how much do you get from that rental? Well, we usually get like about $2,100 a month. And that would be enough to qualify in this case. But we take a lot of deductions, like we take down, this, that, and the other. And I said, well, if you didn't take those deductions, you would have enough income to qualify. And he's like, well, I hadn't really thought about it that way. He was also thinking about taking some money out of a 401k, even if it's just for this, 6 months to get by. That's taxable income. So it's a matter of having a conversation about not exactly what's happening today, but what can I hope for next year and what are creative ways. Some people I work with are turning 62. They qualify to take their Social Security. They don't want to take it early because they don't get as much or as they would if they waited. But if that's what you need to get by, to live on, and you need that to get health insurance, then it may be a good idea to go ahead and apply for your Social Security benefits. So we talk through people various ways that they can think about creatively about what their income is. So you can kind of see here, a family of 5 can actually earn up to $122,000 a year and still qualify, but need to have this sort of minimum income. In most cases like this, when you're in this income range, your children aren't on the marketplace. Generally speaking, they would be on Medicaid or Florida Kid Care. And I'll talk about it at the very end. And the parents would be on the marketplace. So that's generally how that comes off. Those who don't qualify for financial assistance is also important to recognize. So obviously, like I mentioned, if you're earning more than 400%, you're not going to qualify for the financial help. Now, you might project that you're going to make that. And if halfway through the year you're on a marketplace plan and something happens and you lose your income, then you can qualify for the financial help and you would just update your application. If you're eligible for any of these government programs, Medicaid, CHIP, which as I mentioned is a Florida Kid Care, Medicare, TRICARE benefits or VA benefits for our veterans, or you're in the Peace Corps, then you wouldn't get any financial assistance from the marketplace. You would use one of those programs. And here's the final one that's really sometimes tricky for people to figure out. If you have health insurance offered by your employer, right, and it's not ridiculously high, which is 9.83%, which is pretty high standard, and it's decent value. I mean, it meets the criteria of the Affordable Care Act. It has the pre-existing issues. It doesn't have, it won't stop working in the middle of your care, that sort of thing. You got it. Generally speaking, you can't take financial assistance from the marketplace. The exceptions with that would be employer coverage that's above this threshold, or sometimes employers will offer what we call like your old-fashioned sort of indemnity plans, or plans that just kind of cover you for catastrophic care, but they wouldn't cover you for preventive care. They don't meet those standards. So you really have to take a look at what the employer is offering. I have people calling me every day who say, well, my open enrollment for my employer was, 2 weeks ago, and I didn't sign up because I thought it was really expensive. So let me just jump on the marketplace. And I'll say, well, let me take a look at that. And we'll find out that their health insurance is really only 4% of their income, which is way below this, but they've missed the open enrollment. So that's really unfortunate. So be really careful when you're being offered coverage from your employer, that you talk to somebody to make sure it's not meeting those affordability standards, because if you miss that, you may miss out on an opportunity to get health insurance. So what income do you count in the marketplace, right? So most people just think about their job, what they get from in their paycheck. It's your gross income, not your net. And if you're married, you have to include your spouse's income. You have to file jointly to get marketplace financial help. Self-employment income, that's the stuff that people do. So for some people, this is their full-time income, is self-employment. For other people, it's their side jobs, it's their side hustle, it's the little money they make here and there. It really depends, and I'll talk a little bit about that in a second. If you received unemployment benefits for 2020, those would count. It's really unclear right now whether unemployment benefits will be extended into 2021. We don't know if we're going to get some federal relief. It's impossible to predict that right now, unfortunately, but maybe we'll know something in a couple more weeks. But unfortunately, it's open enrollment now, so you have to kind of look at other sources of income. Rental income counts, like with that example that I mentioned a minute ago. If you're renting a property or renting a room in your house, even to somebody. Investments, capital gains, like if you're taking money out of a 401k or other investments to just kind of get by right now during these crazy COVID times. Social Security counts. Taxable scholarships tend to be for college students who are getting a taxable stipend for their living expenses. And then alimony also counts if you were divorced before January 1st, 2019. What won't count is some of these other payments, SSI, or let's say you had an auto accident, 4 years ago, and you're living off of those payments from some sort of a settlement. Well, you're not paying tax on it, so it's not counted as taxable income. So I like to really think creatively with people about self-employment. These tends to be the things that we hear from people, like, well, I've been making this money on the side, but I've never put it on my taxes before. No one knows about it. It's not my main job. It's just my side gig. I only do this, I only work seasonally. Well, now you need to think carefully about whether this is the minimum income that you need to qualify for the marketplace. And you'd have to put it on your tax return. You got to pay taxes on it. You don't get something for nothing. But generally speaking, if it's not a huge amount of money, the amount of tax that you would pay on it is so small compared to the benefit of having health insurance available to you that's subsidized by the federal government. So again, we have these conversations sort of every day with people about, what are you doing to get by? Maybe you haven't been counting that money that you've been earning delivering groceries to your neighbor, or even babysitting your grandchildren. Some people I work with, their children pay them a couple $100s a week to babysit their children as a way of sort of helping them out. Well, that's income, and it can be counted on your taxes, and then you would have income. So just talk to us about that if you have any question about that. What's the enrollment process look like? Well, if you work with us, we will do most of our work now online. We'll see people in person if absolutely necessary, but most people actually prefer right now not to have to go face to face and deal with wearing a mask and all of that. You fill out the application, it's pretty easy, and then you put your estimated income, your expected income for the next year, and immediately you get a letter back from the marketplace that says how much tax credit you're eligible for. That tax credit is not money that goes to you in your bank account. That money goes to the health insurance company that you choose. So for example, if you find a plan on the marketplace that costs $300 and your tax credit is $250, the government sends $250 to that insurance company and you send $50 every month. It's a shared sort of responsibility. There's no health questions on the application, but if you smoke, it will cost you more for your health insurance. And then we sit down and look at, okay, what can you afford? Are you willing to pay anything? What's your health situation? If you're one of those people that just says, I never go to the doctor hardly, I never get sick, I just want to have this just in case, that's a different from somebody who says, yeah, I have diabetes, I have high blood pressure, I need a surgery on my knee, I'm at high risk for, some kind of cancer. They might have a different, completely different situation. Your provider network. Some people are very, very wedded to their primary care doctor, and they won't take any insurance that doctor doesn't take. Other people say, I didn't, my primary care doctor is getting ready to retire, or I didn't like her very much anyway, so I'm willing to change. And then also your risk tolerance. Some people just say, I'm willing to take the risk of, paying a little bit per month to have, but a risk if I have to owe for something big like a surgery, I'm taking that risk because I'm just willing to do that. Other people say, wow, I want to have a plan that covers really for almost every eventuality because, like I say, if I have a history of cancer in my family or I'm very accident prone. So that just really depends on everybody's individual situation.
Can I jump in and ask a real
Yeah.
quick question, Anne?
Sure.
So, in regards to, again, to just bring it back to COVID, do you think that, obviously not asking for like a direct advice piece necessarily, but do you think that that's going to be something a lot of people take into account, whether or not they're high risk for COVID when it comes to those kind of decisions?
Depends on what you consider as high risk for COVID, right? So the people that tend to
Sure.
be, we don't know. We don't know enough to say, we know that people who have under some underlying health conditions or who are obese, who have certain conditions are more likely to wind up getting really sick from COVID. And like, for example, wind up in the hospital on a ventilator and maybe in the ICU and be really, really sick. Other people might consider themselves high risk to being exposed to it, like if they're in the health field or in a field where they're in contact with people all day long, but they're perfectly healthy and think, well, if I get it, I might just have to stay home and be sick for a week or two in quarantine, but I won't wind up going to the hospital and needing care. So
Mm-hmm.
it depends. It kind of depends on how you feel about that. I think that people generally will not necessarily pick their insurance based on their COVID risk or worry about winding up in the hospital with COVID, but they're looking at other things that they're normally worried about. Like I have diabetes, or I could, I have a high risk for colon cancer in my family, or I've had, an abnormal pap in the past. So I want to have something. So it's hard to say.
No, I appreciate that. And that actually, I appreciate you clarifying that because that makes a lot of sense actually. And thinking about the underlying health conditions, I mean, already I think seems like that was something that people would take into account. And so COVID's just kind of adding to that already existing like repertoire of things you might be at risk for.
Another thing to think about is when people talk about in the news about if you have COVID, where should you go, right? And they often say, call your primary care doctor and ask their advice first, at least in the beginning of the pandemic where nobody really knew where to go for COVID testing and things like that. Well, if you don't have a primary care doctor, there's nobody to call. So if you have health insurance, you should have a primary care doctor. You either get assigned one if you're an HMO or you pick one. And then you have some place where you can call and get advice, and they should give you the up-to-date information about who's got what kind of tests. Right now, the testing is free. And even if you go to, urgent care, the test could be free. But let's say you go into urgent care for a test, but you have a lot of symptoms that need to be treated. Maybe you do have a really, really sore throat, or, maybe you just have a sinus infection, but you don't have COVID at all, but you need to get that treated. Well, if you don't have health insurance, you're paying the full cost for that urgent care visit versus what you would have paid if you had had health insurance. So I think it's just another reason to think that this is an important investment to have this, especially when you're in a pandemic. I like to give a couple of words. People get confused all of the time. And this is sort of like, health insurance 101. So I'm just going to go through these really quickly, but I can't really do them justice in this short time. But because I'm going to mention deductibles in the next slide, I wanted to just kind of go over them. So premium is what you pay every month. That's regardless if you go to the doctor. It's regardless if you get sick. That's just the cost of doing business, right? So it's sort of like cable, right? You buy cable and maybe a month you're on vacation and you don't watch your cable. Well, you don't cancel it. You just have to pay for that month. And same thing with your car insurance. Just because we're not driving right now very much, most people aren't canceling their car insurance. It's just the cost of doing business. The deductible is amount of money that you may owe for healthcare, right? If you need certain, care outside of, usually your primary care. I try to tell people when you're picking a health insurance plan with a high deductible, right? Make sure you look for a plan that where you can see at least your primary and possibly a specialist for a copay, which is a set amount. Usually for primary care, it's $25 or a specialist will be $50 or $75. you don't want to pick a high deductible plan where you don't get anything before the deductible, because then it's like you're paying a lot of money and you got to spend a lot of money before you get any benefit out of it. But the deductible is not something to be afraid of. If you don't get sick all year round and you just go for your annual checkup, maybe you go for your gynecology visit, you go for your mammogram if you're old enough for that. And if nothing comes out of that, then your deductible is irrelevant. You're not subject to the deductible for those services. So not to be afraid of that. Copay is like a set amount, $25. You just got to pay to get that care. Coinsurance is a percentage of something. So this often applies to things like if you're having surgery or an outpatient procedure. So let's say you're having a surgery, an outpatient surgery that costs $2,000. Right, instead of paying $2,000 toward it, like a certain set amount, you would pay a percentage. So often things like 25%. So you pay $500. It's like your portion of the bill. And then your out-of-pocket maximum. I used to basically tell people this is like your worst case scenario. People who have out-of-pocket maximums in $8,550, which is the maximum for this year. That means if you wind up in the hospital with COVID and you're in the ICU for a week, and you come out of it, you're not going to owe a week's worth of bills. You're going to owe the out-of-pocket maximum. You're going to owe $85.50. And after that, your insurance will cover the rest of your bill for the rest of that stay, as well as for the rest of the year. So it's kind of like it's a assurance against bills that are $20, $30, $40, $50,000 that you would owe. So those are just some important terms. And the reason I mentioned that is I gave a couple examples about what it costs to get health insurance right now on the marketplace. So this is a family of 4 with a modest income of $42,000 living in Orlando. In this case, it's a married couple with 2 children. Their kids qualify for Florida Kid Care, which is our children's health insurance program. Cost is $20 a month total. And the parents can come to the marketplace. And so they have a choice of either that this is the help that they qualify for, that advanced premium tax credit. So this amount of money would be sent to the insurance company on their behalf. So they can even pay nothing. If they really are strapped and they are barely making enough money to eat, and they say, we can't afford anything right now, then they can get a plan that costs $0, but they have a high deductible. So it means if somebody gets sick among the parents, they could be out, several $1,000s for that care. Conversely, they can get a low deductible plan with maybe $1,000 to maximum deductible, or even a $0 deductible plan, but it's going to cost them $156 a month total. So about $75, whatever that is, $77, $78 per person per month. So they can choose based on their risk tolerance, their financial situation, or they can even split up and one person get the high deductible plan who's very healthy and says, I never go to the doctor. And the other person maybe who has health conditions that are, chronic and goes to the doctor a lot could get the low deductible plan. So you can divide if you want to. Here's another example of somebody who's a little bit older. So the older you get, the more your health insurance costs, of course. And he's making $39,000, which is less than the other family, but he's only a tax household of 1. So he could qualify for a credit of $557, and he has choices between a $104 a month plan with a high deductible, or paying more per month, but having a much lower deductible. So again, if he's one of these folks who's really healthy and doesn't hardly ever go to the doctor, he might say, I'm willing to take the risk. I only can afford this right now, and I'll deal with this problem, when I come to it, if I need some care. But if I don't ever go to the doctor all year round, I won't even owe any of this. Or he could be like, wow, I need knee surgery, or I can't do my job. I have to get this done now. Let me pay the $400 a month. But when I get my surgery, I'm not going to owe, thousands and thousands of dollars. So again, everybody has different preferences and different situations.
So just to add, to clarify on that, and I appreciate your clarification. I'm still figuring all this out myself. So if I pay the $399 a month for the monthly premium, that goes towards the $1,500 deductible credit, or no?
No.
Okay.
Separate. Premium is just
Separate.
the cost of doing business. Just you have to pay that. The deductible is separate.
Gotcha. Okay, I appreciate that clarification. Thank you.
Right. And also your premium doesn't count toward your out-of-pocket maximum. but the deductible, the co-pays, the co-insurances, all those fees that seem to come with everything, those will be included in your out-of-pocket max. So this plan might have a $1,500 deductible and maybe a $2,000 out-of-pocket max. So the difference between those two may be some co-pays or co-insurances that you incur along the way. And then when you get to 2,000, then your plan covers everything after that. So
Thank you for that clarification.
Premium's not part of the deductible at all. And then here's another example of, someone who's 28, single, in zip code 32811. So also again, in Orlando area, works as a yoga instructor and makes $15,500 a year, right? So Ingrid in this case qualifies for $370 a month in help. Now, she's in this category where if you're earning below 250% of the federal poverty level. So for a single person, that's right around $30,000 a year. You can get a low deductible plan with a zero deductible for less than $25 a month, right? So if I was talking to Ingrid and I would say, look, Ingrid, could you afford $25 a month, right, to insure yourself against, catastrophe? And in this case, Ingrid called me back after enrolling in a plan. She picked this one because right now she's just like barely struggling. She's super, super fit, super healthy, uses like holistic medicine and just sort of getting this as just like a worst case scenario. But a week after we enrolled, she found out she was pregnant, right? So she's like, wow, I really need to change. And you're able to, because it's the middle of open enrollment. You can't change outside of open enrollment unless you have certain circumstances. She changed to the lower deductible plan because having a baby is going to cost a lot of money. The hospital bill is just the beginning of the cost of having a child. Let me tell you that. So she switched to a low deductible plan so that when she has her delivery, she won't owe nearly as much as she would have with a high deductible plan. So again, your circumstances may change your thinking. And I have to mention that again, during open enrollment, you can choose your plan. But once open enrollment's over, you can't just pick a high deductible plan, pay nothing. And then 3-4 months into the year, you're like, oh, I need a surgery, or I just found out I'm pregnant or whatever. Let me switch. It doesn't work that way. You can't switch until the next open enrollment unless there's some major life change. So a major life change may be having a child would give you an opportunity for a special enrollment, but that's after the child is born. You can't do it sort of in the middle of the year just because.
Okay, and what is the enrollment window again? What is like the start date and end date?
November 1st to December 15th.
Okay, so we're coming up on it, as we mentioned earlier.
Coming up on the deadline, exactly.
Gotcha.
Finally, for those who do have kids, I like to mention, I've mentioned Kid Care and Medicaid a couple of times. So if you have children, young children under 18, and your income is below 200% of the poverty level, Kid Care looks not at your annual income, but your monthly income, and it looks at where you are right now as opposed to what you've earned maybe earlier in the year. So you can earn up to 200% of the poverty level. So this would be, for example, let's say you have a single parent with 2 children. That parent can earn, almost $4,000 a month and still have their kids qualify for Kid Care, which would cost you $15 or $20 a month per family. And it's very good care, very comprehensive. Adults, unfortunately, in the state of Florida generally will not qualify for Medicaid unless they have young children and are very poor. We're talking about less than a few $1,000s a year in income, are disabled, are pregnant, and they can get pregnancy Medicaid for the time during their pregnancy and delivery, or if they're 65 and very poor. But generally speaking, if you're a childless adult between 18 and 64, and regardless of your income, if you're very low income, you're not going to qualify for Medicaid in Florida. And so just a reminder that we help people use the marketplace application sometimes to apply for Medicaid and Kid Care. So the idea is that you can kind of use one application for your whole family. Parents are maybe on the marketplace, but the kids go to Kid Care or Medicaid. So we try to make it as easy as possible. Okay, so here's the timeline for enrollment that we were just mentioning. It's coming up on the deadline for that. This is how you reach a Navigator in Central Florida. This is our main number. We don't have the resources to answer that number live. So leave a message. We'll usually call you back within a few minutes, if not an hour or two at the most. We take turns as a team answering the phone between appointments. We also have a website called coveringcfl.net, and you can schedule your own appointment on there. I'll show you how to do that in a second. If you don't want any help from us, You can just go to healthcare.gov. I caution people to use any other site. There are lots of sites out there that make you think that they're healthcare.gov, but they might be like healthinsurance.com or Obamacare. Whatever. And if you put your email address or your phone number in one of those websites, you will be spammed and you will get calls. So I'm encouraging you to use the official government website, which is healthcare.gov. Or you can also call the Federal Marketplace call center. They will do an application over the phone. They won't know as much as we do here locally about the hospitals and the providers and all of that, but it is an option for people if they, for some reason, they don't want to work with us. I don't know why they wouldn't, but we're great. This just shows you how our website looks. When you go to Covering CFL, there's a box that says schedule an appointment. We says virtually here. Like I said, if you have to meet in person, we would work something out. You get this little scheduling tool. You put your zip code in. Because we're virtual right now, it doesn't really matter like this distance thing at all because we're doing it virtually. And then a bunch of appointments will crop up, and you can choose. Sometimes the name of the Navigator will show up, like Doris. There's mine. Appointment will show up if you want a certain person, and then you schedule your appointment online. And the Navigator, if they're not familiar with you, would generally call you like the day before and just kind of get a situation like, are you new to the marketplace? Do you have, a large family? Kind of talk you through it so that you're preparing for the appointment. So it's pretty easy to do that. And that's it. That's just my direct contact information. I encourage people, I'm going to go back to our contact information to make an appointment, to go ahead and schedule now and not wait until the last week of open enrollment, because we will get really busy. And also sometimes the website crashes on the last day. And it causes a lot of stress. So I encourage people to get this done sooner rather than later.
That takes me back to the deadline for a homework assignment of being in college. Like if you wait till the last minute, sometimes the computer crashes or the site overloads. So thank you so much, Anne, for this information. I greatly appreciate it. I know that so many of our clients and our audience appreciate it. We will be posting a follow-up with just a bit of this information in case you missed the video. We'll also be tagging and including the website information that Anne mentioned. But again, Anne, thank you so much for what you do, what your organization does. You genuinely just care about the people that you help, and that's what we're about here on Coping Together. So thank you again so much for being here.
Thank you for what you do, and hope everybody kind of gets an opportunity to really get the facts, get the information, and like what you do every day is, just reach out, just give us a call and we'll try to help.
Absolutely. So thank you again so much. And thank you to all of you for watching. If you have any topics you want to see covered, anything like that, please reach out to us at the Mental Health Association. If you're having trouble with trying to find resources, let us know. If you're wanting to find out information about insurance, contact Anne or contact her organization. But thank you again all so much for being here. Thank you, Anne, and I will see you all next time. Thank you.